a good question I get every now and then. What's the best way to choose a psychotherapist or a psychologist for psychotherapy? Well, the first thing you need to do, of course, is to narrow it down quite a bit. We have over 16,000 psychologists in Canada, and half of them are in Quebec. So, of course, they don't all do psychotherapy, but many do. A good place to start, if you feel comfortable doing this, of course, is to ask friends if they can recommend someone. You can also talk to your GP, or you can talk to another health professional and ask them if they work with a psychologist and if they could recommend one for you. That's probably one of the best ways to start. In fact, according to the Canadian Psychological Association, about 60% of people find a psychologist through their family doc, and the rest, most of them, the second most widely used strategy is simply using the web, which is used by 18% of people looking for a psychotherapist. So now that you have a couple of names in hand, the next step is to make sure this person is really licensed to practice. And you can find this out very easily by contacting the regulatory body for psychologists in your province. So you can just do this with Google. You search for psychologists, college, and then the name of the province you live in. So if you live in Ontario, for example, you just Google College of Psychologists of Ontario. And that's true of all provinces except for Quebec, where you would type Order of Psychologists of Quebec. Now, many of the colleges have a directory on their website, so you just have to enter the name of the person to see if they're licensed. Otherwise, you can just simply give them a call over the phone. Alright, so now you've selected one or two professionals and you're about to meet this person. Rule number one is to always trust your instinct. You need to feel comfortable with this person to build a good working alliance, something researchers often call the therapeutic alliance. If you don't have a good alliance, then the treatment will not work as well. Now, we sometimes hear people say, and this includes psychologists, that the only thing that matters for a therapy to work is a good alliance, but that's not exactly what the research says. There are many, many things that will have an effect on your treatment outcome, and what seems to be clear is that the alliance is a necessary ingredient, but probably not a sufficient ingredient in and of itself for therapy to work. Here's a second rule you shouldn't forget. You have the right to ask questions. If you feel too vulnerable and you're afraid you won't be able to ask these questions, hey, why not bring a friend or bring a relative to the first session? First, ask the clinician what his or her area of expertise is. Sometimes it's better to avoid people who claim to have expertise in too many things. You know, people who can treat depression and anxiety and personality disorders, and who can also do consulting in firms and companies and offer executive coaching, and who do individual and family and couples therapy. At one point, someone's got to draw a line. A second question, which is related to the first one, is to ask if they have expertise with people who have problems similar to yours. One of the most important factors in developing a true expertise as a professional is clinical exposure. This means the more the person has worked with people in a situation that's similar to yours, well, the better it is for you. Another good question to ask is, maybe towards the end of the session, is if this therapist can already establish a diagnosis or a preliminary diagnosis. Sometimes a diagnosis is simply not necessary or useful. And if that's the case, your psychologist or your psychotherapist should be able to explain why this diagnosis is not useful for you, and for you in particular, not for everyone in general. Other times, however, a diagnosis might be helpful. For example, maybe your insurance company will ask for one to cover the cost of psychotherapy. Or a diagnosis can help you find other resources that might be helpful, like support groups or community organizations that help people who have, for example, depression or anxiety or other conditions. The next question to ask is what treatment he or she recommends and whether there's scientific evidence demonstrating that this treatment works for people who experience difficulties that are similar to yours. So some psychotherapists, and that's really unfortunate, will offer a particular type of psychotherapy simply because that's what they know and that's what they can offer. Others will tell you that all that matters is the therapeutic alliance, but like I said, that may be a necessary ingredient, but it's certainly not the only thing that matters. So if you have a diagnosis and you're looking for a treatment for that condition, ask your therapist what evidence exists to support the therapy he recommends, and then ask them where you can find that documentation yourself. Now, building on the question we just covered, a next good move is to ask your clinician if there are clinical guidelines or best practice guidelines or treatment guidelines that apply to your situation. These guidelines are really important because they describe interventions that are more likely to be effective in cases like yours. And again, ask them or ask her where you can find these guidelines, because many organizations who produce guidelines for practitioners also produce a version for the client, which is something you might want to get your hands on. All right, next question. What are the advantages and what are the disadvantages of the psychotherapy that he recommends? Your therapist should be able to explain this in a clear and simple way for you to understand. And don't hesitate to ask how long the therapy might last or how much it will cost overall. Keep in mind, though, that it's always very difficult to determine how long a treatment will last. But if you have an accurate diagnosis, then your psychotherapist or your psychiatrist or your psychologist should be able, based on research, to give you a sense of how many sessions are normally needed for people who have the same diagnosis. And ideally, they should be able to give you a sense of what might happen if your condition is not treated as well. For example, for some conditions, therapy might lead to significant changes in as little as 10, 15 sessions, whereas if they're left untreated, that condition might take up to 2 years to disappear. Finally, one last question. Ask them how they will know if the therapy is working. Of course, you're going to have a sense of this yourself, but it's also good to have their perspective on it. Ideally, a good clinician will track your progress continuously, almost every session or every second session or every 3 sessions, with a valid instrument. And this is a really important point, because research has shown that the clinical judgment of therapists, when it comes to predicting treatment failures, well, it's not all that good. So there you are. Good luck with your therapy, and remember, it's a collaboration. It's a process, so you can't just sit there and wait. You'll have to do your share as well. If you're looking for additional information on choosing the right therapist, you'll find some on the websites of the CPA, the Canadian Psychological Association, or the APA, the American Psychological Association, and on the psychotherapies.ca website. And of course, there's some more information on the website of Medipsy.